Bonjour. Today we have Trent with us, and so you came from how far did
About
you
2 hour drive.
2 hours drive.
2
okay.
hour drive.
All right, and you came with your wife,
Yes.
right? Okay,
Yes.
which has been a patient of mine.
Right.
All right.
Yes.
So basically, what can I do for you?
I'm having some lower back pains,
Okay.
some foot cramping I can't ever get really rid of. It happens a lot at nighttime.
Oh.
Maybe some breathing issues, get up in the morning, you're super stuffed. It takes a while for it to kind of get out of your system, and that can kind of hamper your mornings when you're just stuffed up and trying to get everybody ready for school and get yourself ready. So.
All right. Do you mind if I ask you a little bit of question about your low back?
Oh, no, go ahead.
Okay. So for how long you had that problem?
A couple of years, I would say.
Okay.
Yeah.
So is it on and off, or is it every day, or?
It can be on and off, but it normally comes, I might sleep wrong and get stuck, or I sit in the office at a computer all day, so then you're kind of hunched over, I might not sit correctly, and it just starts to build up, and then you have to get up and move around and try to stretch to make it feel better. But then it always feels like it lingers around, and you can't really figure out how to get rid of it.
So basically, in order for this to get better, you need to get stretches, right?
Stretches or some type of treatment maybe to
Okay.
get over the hump.
What kind of treatment did you seek?
I went to a couple chiropractors, but it's kind of those like spot treatment, like it helps that day or something like that, but then it's back a couple days later.
Okay, so you wish it will last longer,
Yes.
right? Okay.
Yes.
How this is? Can you describe the pain? Is it like a sharp pain? Or
It's not
dull
sharp pain, it's a dull ache. And
Okay.
it just sits there, and if it just goes up and down your back, it's a dull ache.
So how this is impacting your life?
It does impact it. You can't sleep very well. It gets uncomfortable at work. Like I said, you got to get up and move around. That takes you away from your job. Like they say, time is money.
Yes.
So that hinders in that way. But I would say mostly it's sleep. Trying to get comfortable before you go to bed is a tough one.
Does it wake you up at night sometimes?
It has woken me up at night, and then I got to get up inside of bed and stretch and move around. Then at that point, I'm awake. So then it takes me a while to wind back down and go back to sleep. So I would love to get rid of that.
Yeah, sleep is pretty important,
Yes,
right?
very
For
important.
sure.
Very important.
Okay, and so is it like localized in your low back, or is it like going?
It doesn't. It never worked up. It's just localized right in this section back here.
Is it like a band lag on your low back?
Yes.
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 So here's the thing, what makes me different, it's like when you do like regular chiropractic work, you work really on what we call the peripheral nervous system. So all the nerves that are coming out of your spine, which is only 20% of your nervous system. When you come to see me, we work also on your skull, which is called the central nervous system, which is 80% of the nervous system. So, you know, do you want to have 100% of your nervous system treated, or only 20%?
100.
You see what I mean? So
Yeah.
that's why I'm a little bit different. That's what makes me different, and hopefully we can, you know, have better resolution with your case.
Oh, awesome. All right. So get to about here, I can start to feel it flare up, and get about there. That's when the pain really kicks in. About there.
Right there?
Yeah. Right here. Right here.
Okay.
Right here in the section right there.
Okay. And that's it?
Oh, I
That's
get a
how
little
far you
further,
can go?
but that's.
All right.
I don't feel like going past
Why don't
that.
you stand up? Why don't you
Back.
accentuate your curve like
All
that?
right. Go back there. I can feel the pain
Okay.
at the
Is
same
it,
spot.
is it a different kind of pain, or is it the same?
This is sharper going this
That's what I
way,
thought,
and it's
yeah.
more dull going back
Okay.
this way.
Awesome. Anything else you want to do? We want to check how much stress you're having. And sometimes you're not even aware. You know, you may have pain here, but you may have tightness in your neck and things like that, right?
Right.
So you may have some sore spot basically that you didn't even realize that they were there. Would be nice if we can get rid of those two, right?
Right, yes.
All right, so let's do this. So I'm going to ask you number 1 to 10, you know, and you give me number here.
Oh, 8.
8.
Ouch.
Okay. Here.
Oh, 8.
Okay. So let's do right here.
I don't know. That's about a 4.
4.
Wow.
Okay. Here.
About 3.
Okay, let me check your gut because there's a big muscle here. Oh.
Yeah, that's about 10.
Okay. All right.
Oh gosh. Okay, yeah, that's about 10.
And you have to push it, right?
Yeah, I have to push it back out, yeah.
Okay, give me a number here.
6.
Okay, here.
6, yeah.
Okay, let me check your
A
neck.
little
now.
sore than I thought.
Yeah, always, we
Yeah.
always. Ow. Number.
That's about a 9. That's
Back
about,
here.
okay.
So give me a number here.
Ow, 7.
7. Woo.
7, about the same.
Yeah. Here.
Oh, that's about 8.
8.
That one's not as bad. That's about 4.
Okay. Here.
Oh, that's about 6.
Here.
6. That is tickle, sorry. That's about a 4.
Yeah, so tickle means your energy is not flowing like it's supposed to be, right?
Oh, really? Okay.
Yeah.
Ow! That was a 9.
Okay.
That was about 9.
And here?
7?
So that's pretty bad right there, right?
Yeah.
Let's check your spine now, number.
Oh, that's about 3. That's not
Yeah.
bad at all.
Here,
4. Oh,
here,
that hurt a little more. Yeah, that's about 7.
here.
6?
How can you live like this, man?
I don't know. I'm trying to. That's about a 5. Not too bad. About 5.
There. And your neck.
That's about 7.
All right. Okay, so you see, did you have some spots that you were not aware of?
Yes.
Which one?
Definitely.
Give me an example.
My calves and
Yeah.
my neck were way. When you hit them, the number pain was fairly high.
So you mean you thought you had no trouble there,
Right.
but when I hit it, it was
Yeah.
like really painful, right?
Exactly.
So that's what I'm talking about, is the hidden stress.
Mm.
So what if we can get rid of, why you are here, right? I mean, to get rid of your low back, but in the same time improve and release lots of stress in your legs, in your upper body, in your neck would be cool, right?
Right.
Well, that's what we want to do. And
Alright.
this technique, it's going to put more oxygen in your body.
Okay.
Oxygen, we need oxygen in order to live,
Right.
right? I mean, 3 minutes without oxygen, this is over, right? So I created a technique that, will bring more oxygen in your body, heal your body, and help your pain,
Okay.
okay? Turn your head away from me. Feeling more relaxed?
Yes.
Okay, can you turn your head the other way? Gonna do your gut a little bit because you have quite a bit of stress. Okay, let's do the other side. Number to start with. Number here?
0.
0? Wow. Number?
0. I have no pain. No pain. 0. 0.
Let's do here. You
Oh, it
got
just caught me off guard.
number?
Go get it.
No.
1.
Okay. What's about now?
0.
So I'm using a muscle reflex technique, right? What do you feel? Do you feel the muscle melting? What is it that you feel?
I feel. I mean, it feels relaxed. I feel
Okay.
the pain's gone.
Number here?
0.
You feel more relaxed when you do that?
Yeah, it's kind of hard to explain. I don't know. It's just from what you did earlier to now. There's literally. I just feel the pressure of you pushing. There's no pain to it. 0.
Okay. Well, let's check your neck now.
Okay.
Or let's check your feet. Remember, they
Yeah.
were pretty high.
0.
There we go. It was 9,
It was a
right?
9. Yeah, it was 0. I mean, it feels great.
Awesome. So let's do your neck now.
Mm-hmm.
Just give your neck and be relaxed. Good. Good job. Hi. Number?
Oh, 0. Wow. 0.
Number?
0. Nothing.
Excellent. It's good?
Yeah. That feels great. I don't know. I really can't explain it. But I feel like I have a lot more range of motion than I've had earlier. I do feel a little bit of restriction.
Where?
Right where your finger is.
Yeah?
Yeah.
Any better if I do that?
Yes, actually, yes, a lot better.
Good.
I just felt like I was getting stopped from moving. Sorry.
Good.
Yeah.
How do you feel?
I'm trying to hard to explain. I feel like something's moving down my leg, like it's being pushed out
Okay.
or pulled out in your case right there.
But you feel release, so
I'm working on that.
okay, so breathe in by the nose, out by the mouth.
I do. I feel like something's being pulled out.
Just do it. Just.
I feel like it's gone. I mean,
Excellent.
yeah.
So but you mean the stress is gone, right?
Oh yeah.
Wow.
What happened?
I can just feel it. Just my body just
Melting?
melting.
Yeah. Just.
It's just going. I can just feel it moving out.
So what is moving out? Your pain?
It's hard to say. I don't know if it's
Okay.
pain or what, but I can just feel something exiting.
I'm going to put that under your shoulder.
Okay.
Very good. Grab my forehand and relax.
Okay.
What do you feel?
Oh, I feel a pinch. Sorry.
Where?
Oh,
No
right
problem?
right there. I think, yeah. Okay.
Okay.
There we go.
Oh. Any better if I do that?
Yeah, it's sore right there. Okay.
Any better if I
Yes,
do that?
right there.
Here we go.
Yeah.
So breathe. Good job.
Strange. I could feel where you grabbed me.
Yeah,
It hurt at first, but I don't know. Now it doesn't hurt at all.
it's pain-free.
Yeah. Oh,
What's going on?
I just felt pain through.
I need to know that. You feel.
Yeah, that pain right here through my neck and then down onto my shoulder.
Okay. Any better if I do that?
Yeah, that's still right. Yeah, right there.
That's it?
Yep.
Just breathe it out. What's going on here? We good?
We're good. Yeah, we're good. Feel the pain lessen and just go away.
How do you feel?
Very relaxing. Yeah. Unless I might fall asleep on accident.
Feels good.
Where does it feel good? Where?
It feels good going in my.
Awesome. So it's gone here now?
Yeah, oh yeah.
Okay.
Right here. Discomfort right beside my spinal.
Okay. So if I do that any better?
Yes.
Good. So breathe.
Awesome.
Good. What about that?
Right on my right hip. I feel it. Right above where you're pushing.
Okay.
Right there.
Any better?
Yes.
Good.
Right my bicep.
Right there?
A little higher. Right there.
Okay. Any better if I do that?
Yes.
So breathe.
Great. I can feel it leaving.
Where at?
No, that feels good. Oh, you got, hold on. Yeah, right there. Yes.
Any better?
Yes. Keep there, stay there.
Sure. I won't move.
That feel good.
Okay, let's go a little bit further here.
No discomfort there.
That's pretty good, man.
Yeah.
All right. Where do you feel the tension?
Right there. Higher this time. It's more closer to my shoulder.
Any better?
Nope, not yet. Yes,
Any
right
better?
there. Yes. Yeah, I can feel it leaving right now. That feels good. Stop right there. Yeah.
Better?
Not yet.
Where do you feel?
Right, go back.
back to where your hand was. Yeah, right there.
That's where you feel it?
Mm-hmm.
Any better?
Yes.
Here we go.
Feels good. This is crazy. I can literally feel the pain dissipate, just disappear. This feels good.
Better?
Oh, yeah.
Where did you feel it?
Oh, right. Oh, actually, more on this side here, this last time.
Did it release?
Huh? Oh, yeah.
Okay.
Feels good. It's super relaxed.
Okay. Don't want me to stop, huh?
Oh, yeah, no. I feel like I've had my neck stretched in forever.
Yeah, here we go.
Yeah.
Just breathe. Where, here?
Yes.
Any better if I do that?
Yes.
Good?
Yep.
Just breathe. Yes, good job. Any better?
Yes.
Here we go. There we go.
That feels good. Actually, I don't have discomfort. Let's hang off the table. Go to sleep.
Some deep breath here.
Oh my gosh. I think I felt every vertebrae or whatever is popped down from my neck down to my butt.
That's a lot.
Yeah. Oh man. I don't even know how to react to that. That is kind of lost words. That was insane. We catch my breath. Oh. But it did
Just
feel
make
good.
sure you breathe.
Yeah.
Yeah.
Oh man. Whew. Man.
You feel tight or you feel
No, I don't
released?
feel tired at all. I feel like you pulled everything out of me.
You think you're taller?
I might be. I might be a bit taller.
Even if you can just bend over?
Yeah.
Oh, that's even more, right?
Touch the floor.
Excellent. Do you have any problem?
No, I mean I get down and touch the floor.
No tightness at all?
No tightness.
I can release it.
Yes.
Wow, let's try to move around and trigger some pain. That's pretty good.
Yeah.
Do the other one. Good.
No pain
Remember
there.
this one, that's what I want.
No sharp pain. Like I
And you
mentioned
see how
earlier.
the range of motion are much.
Yes,
you can
that's
go
right, yeah.
farther away.
I might be able to win a limbo contest.
Yeah. We're going to do next the balloon, right? And the balloon, what does it do? It's just, moving your cranial bone.
Uh-huh.
You've got 22 cranial bone in your skull, literally, right? And so if we can move a central bone in your skull, it's called the sphenoid bone.
Mm-hmm.
And it actually looks like a butterfly.
Okay.
So imagine this is sit like right at the center of your actually brain and skull, right? So when we can move that sphenoid bone, we can remove remaining 21 bone in your skull.
Okay.
Why is it important? Is it imagine this is your skull and this is your spine, right? So if your head is going a little bit forward, your spine is going to compensate and you're going to have a hunchback. You see, like with people like that?
Right.
Okay, but if we can realign the sphenoid bone, it's going to realign your head to your spine, and the spine doesn't have to compensate, so it's going to be straight.
Okay.
So that's how we can impact your low back to make sure that it's going to stay better for a long time.
Right.
Remember at the beginning we talked about 100% of your nervous system, right? This basically, right there, does only 20%. All that does 100%. And that's what we want to do. So by moving that sphenoid bone, this bone in the center of your skull, is going to really release your brain.
Gotcha.
In the same way, so that's how we can impact your central nervous system, which is 80% of your nervous system. By the way, when we did the strap here, we move the backbone here is called the occiput. So
Okay.
it was kind of also the cranial thing.
Okay.
Okay, but this is going much deeper. The way we got access to that sphenoid bone back is through awesome. Lock your elbow straight. Push back. Very good. Okay, let me write that down. All right, now I know where to insert the balloon. So let's. There we go. Can relax.
I can breathe way better now. Oh my gosh. Sorry, I got tears.
It's okay, it's a reflex.
My goodness. Oh, wow.
You know what breathing means now.
Yeah, I guess I've been breathing right because that was a completely different experience. It felt like something popped and air just flowed out. It just, yeah. Oh my goodness. Hey, you mind if I blow?
Yeah, of course.
Oh.
Did you feel it somewhere in your face, in your skull?
And I felt like right behind my nose, I felt something pop, and then just everything shot out. Yeah, I don't know how to explain that. Instead of behind my nose, it might have been further back where I felt it, but I don't know. It happened so quick; it was hard to.
What did you feel?
I felt actually, I felt like an explosion. It felt like, and then just everything shot out, like I just released something. I don't know what it is, but everything feels easier now to breathe.
Chin as much as you can and don't move.
All right.
Very good, tuck it. Awesome, good job. All right, I'm going to pre-inflate. You're going to feel some pressure. And good. I'm going to turn your head. Make sure you raise. And Trent, whenever you're ready, just take a big deep breath and hold it.
All right, here we go.
Here we go.
Oh my goodness. I don't feel different. I felt like you expanded the airway. When it expanded, I felt like, again, just another rush. But it's hard to describe. It felt different. I didn't feel the crack like a pop.
So you feel more expansion of your
Yeah.
skull?
It's
or-
weird. It felt like this side moves, like popped something to let it out, and this side just expanded it more to like deepen the effect of what on this side. I don't know how to better to describe it. It's something you got to experience better than me telling you. It felt like something shifted. Like the other one felt like it broke something loose, and this felt like it shifted everything into place.
Okay.
That's the best way I can describe it.
Good.
But I do know I can breathe way better. And I already thought I was breathing okay, but this is a complete different
Level
of breathing. Yeah.
So if this was a 10, how many percent you think you can breathe better now?
Oh, earlier I thought I was a 10. I guess this would be like a 25.
Oh,
yeah.
right. So like how many percent? 50% better? 10%
Oh, I'd say probably
better?
at least 80 to 100% better.
Oh, wow.
Yeah.
That's pretty good.
I'm actually kind of speechless.
No.
Great, actually. Life-changing, that's for sure. Yeah, definitely.
Okay, do you mind if we check a little bit some range of motion
Oh, yeah.
and things like that?
Yep.
Why don't you stand up and just remember bend over as far as you can.
Yep.
That's pretty good.
Yeah.
Any
I'll take
problem, any pain, discomfort, things like
No,
that?
I feel great.
All right. Why don't you remember the
Oh,
opposite
back,
here? That's really good.
Oh, yeah.
All right. Awesome.
Appreciate it.
No
Thank
problem,
you. Thank
man.
you very much.
Take it
Yes,
easy.
yes.